depression is pretty highly comorbid with all forms of cancer. So anyway, I was thinking about that as I as I was rereading slides for this article. So, the authors make a good point in the slide that I just wanted to touch on, and that is we often forget that not only is there a disparity in healthcare access and delivery, but there's also a great disparity in research. And the authors point out that this um, uh, research on low income, ethnic minority, cancer, and cancer patients with comorbid depression, that is a woefully understudied topic. So not only are there disparities in care and access, but also disparities in research as well. Um, so there are many opportunities to bridge the disparity gap on the research end as well as the clinical and macro and health access end. So I thought this was also a really thoughtful and important list. Thoughtful in terms of the authors thinking of very creatively uh, and uh, and efficaciously of ways, relatively simple and low cost ways to to address some of the most common social determinants factors that keep people from accessing or staying in care. So I just thought this was a really great list addressing transportation, childcare, language barriers, just helping people uh, stay organized in their life, right? A lot of times people are very sick, and coupled with minimal resource access can be very hard to keep your life organized. So these last two address those as well. So it's a great list. So one thing I'll add to the slide, and these I think these dropout barriers are really thoughtfully articulated and of course supported by their own research, which is one of the reasons why this article is so great. Um, but just to add to the information, the other thing in addition to treatment benefits, and of course things specific to the study, and privacy and other forms of consent, it are also making sure people understand their health benefits as well. This is especially true when people have employer-sponsored plans and many times don't really understand the nuances of their own plan. But also, as you guys know, that many, if not most, of folks who have a Medicare or certainly Medicaid health plan are actually managed by a commercial provider who's working, through a government contract, and they may have nuances, including cost share that or visit limitations that um, the client's patients are often not aware of. So I just like to include that in the informational piece. I find that in addition to talking about treatment benefits and treatment plan in a collaborative way with clients, also kind of being proactive and saying, here's what your health plan, here's your co-insurance, your cost share according to your plan, visit limitations if there are any. I think that people feel uh, much better knowing that up front. So I just wanted to add that there. Another thing I'll add here, and I recognize the opportunity is not always there depending on the community or individuals you're working with, but when there's an opportunity for a patient portal, for them to be able to log in and look at lab results through a computer, or even better, through their phone. Um, when the internet access is available, I don't know why I'm drawing a phone. I'm just doodling while I'm thinking. Um, but if they do have the internet access, they do have the device and the willingness to kind of uh, learn how to use that patient portal system, you can really help increase engagement by the patient or the client, which certainly bodes you a better chance of favorable outcomes, you and them.